Welcome. We are going to get started. Perfect. All right. Well, thank you. I'm Shannon Von Felden. I'm the Vice President of Advocacy at the EveryLife Foundation for Rare Diseases. This is my 8th Rare Disease Week, so I'm sure there's probably a few people in the room have been to more than 8, but welcome to the 15th Annual Rare Disease Week on Capitol Hill and our first Share Your Story Day. We're thrilled to have you here. I know many of you braved the winter elements to be here, and we're happy to have you. We heard from past advocates who attended Rare Disease Week that they were really wanting more time together during Rare Disease Week and more time to learn and network with one another. And so hence is Share Your Story Day. Today will be a day to connect with your fellow advocates and learn more about advocacy and storytelling. So you'll hear from our Rare Voice awardees and artists using art for advocacy today. And then we'll have sessions later today for everyone, including our youth and teens, our young adults, and new advocates. Tomorrow, we'll dig deep into the policy issues impacting rare disease community at the legislative conference and prepare for those meetings with legislators on Thursday. So we're going to go ahead and get started with our speakers. I would like to introduce to the stage Lisa Lengendorfer, who leads federal affairs for Alexion, AstraZeneca Rare Disease, working to advance policies to improve the lives of patients with rare diseases and their families. She also serves as Federal Policy Committee co-chair for the Rare Disease Company Coalition. Prior to joining Alexion, Lisa led federal strategy and advocacy efforts at the U.S. Oncology Network and served in a variety of health policy roles for several members of the House of Representatives. Thank you to Lisa and Alexion, the presidential sponsor of Rare Disease Week.
Hi, everyone. I'm excited to be with you to kick off Share Your Story Day during Rare Disease Week. On behalf of Alexion, AstraZeneca Rare Disease, I want to express my thanks to all of you for being here today. Your engagement and advocacy on behalf of patients living with a rare disease is so important. In rare disease advocacy, we often highlight the following statistics. There are more than 10,000 known rare diseases, affecting an estimated 400 million patients worldwide, including 30 million in the US. Fewer than 10% of these diseases do not have treatments, and 1 in every 2 patients diagnosed with a rare disease is a child. It can take a person more than 5 years to be diagnosed, following visits with numerous specialists, countless tests, and often misdiagnosis along the way. These statistics are powerful, and they convey the breadth of the challenge we are facing in rare disease. But they don't fully describe the urgency needed for policy change or which policies can be most effective. That's where you come in. Many rare diseases are not well understood, and those who are directly impacted by them are the best source of knowledge. Sharing your personal experience about the diagnostic odyssey, the specific roadblocks you faced along the way, how you navigated our siloed medical system and fought against prior authorization barriers, all help policymakers and staff understand why policy change is needed and what they can do to help. Your voice can make all the difference. At Alexion, we are on a 30-plus year mission to change what it means to live with a rare disease. Alexion is focused on serving patients and families affected by rare disease and devastating conditions through the discovery, development, and commercialization of life-changing medications. Alexion was the first to translate the complex biology of the complement system into transformative medicines, and today we continue innovating with our pioneering spirit across diverse areas of unmet need, advancing first or best-in-class medicines and new modalities. At Alexion, patient input is at the heart of everything we do. We partner with patients and caregivers to deeply understand their experiences and incorporate their insights into decision-making at every stage, from clinical development to delivery. It is with this deep understanding of the unique challenges facing patients and their families that we advocate for policy and regulatory change that can have a big impact. Through earlier diagnosis, delivering life-saving medicines, and ensuring equitable access, we can get diagnostic testing to newborns, we can encourage FDA to bring patients into the drug development conversation, and we can ensure that there's a strong regulatory environment that encourages research into rare disease medicines. In fact, it was the Orphan Drug Act, signed into law more than 40 years ago, that sparked the tremendous progress we have seen in the development of treatments for rare diseases. The Rare Pediatric Disease Priority Review Voucher Program built on these initiatives. And these incentives have worked. Prior to these programs, there were only 38 medicines to treat rare diseases. Today, there are more than 600 FDA-approved orphan drugs treating more than 1,200 indications. However, with 10,000 rare diseases and only 600 therapies approved, it's clear we have more work to do on behalf of patients and their caregivers. We look forward to working alongside you and with Congress to ensure that the right incentives are in place to encourage innovation and bring more therapies to people living with a rare disease. So thank you again for being here today to share your story and bring greater awareness of rare disease. Now I would like to introduce our next speaker, Amy Gaviglio, Board Chair of the EveryLife Foundation for Rare Disease. Amy is a genetic counselor and the founder and CEO of Kinetics Consulting, which provides newborn screening and rare disease implementation, policy, and advocacy services globally. Amy currently works with the Centers for Disease Control and Prevention, the Association of Public Health Laboratories, Expecting Health and Primary Health, among many others. She also leads and serves on several committees, including AHPL's New Disorders and Newborn Screening Subcommittee, the Newborn Screening Expert Panel for Clinical and Laboratory Standards Institute, the Scientific Advisory Board for the MPS Society, and the Executive Board for the International Society of Neonatal Screening. Please join me in giving a warm welcome to Amy.
Thank you, and good afternoon, everyone, and welcome again to the 15th Annual Rare Disease Week on Capitol Hill. So I want to start by asking you all to take a breath, a real one, because we all have carried a great deal into this room. The weight of diagnoses that came late or haven't yet come at all. The weight of treatments that exist somewhere but not yet here. The weight of fighting insurance companies and regulators, and sometimes the skepticism of a world that doesn't quite understand what it means to have a condition so rare that most people have never heard of it, and for which almost no system is yet equipped to help. You carry all of that, and you walked in anyways, and that matters. We gather this week at a moment of genuine change. The rare disease landscape is shifting. It's shifting in ways that are deeply promising and in ways that require our vigilance and unity now more than ever. For decades, the rare disease community built the infrastructure of hope largely from scratch. We fought for the Orphan Drug Act. We advocated for newborn screening programs that today save thousands of lives each and every year. We pushed for the creation of programs like the National Center for Advancing Translational Sciences and the Rare Disease Innovation Hub. Most recently, we successfully fought for the reauthorization of the Rare Pediatric Disease Priority Review Voucher Program. We've made the case again and again that rare doesn't mean unimportant, that 30 million Americans living with rare diseases are not a niche population, that we are a constituency, a community, and most importantly, a cause worth fighting for. And the science has responded. We are now living through a revolution in genomic medicine. Gene therapies are now FDA-approved realities. Natural history studies that many of you and your families participated in, giving data, giving time, giving yourselves, are now forming the evidentiary backbone of new treatments and diagnostic technologies. The tools we have today to understand rare diseases, to diagnose them, to treat them, are unlike anything any previous generation of patients and families could have imagined. This is our work. This is what we've built. But here's the honest truth about this moment. The policy environment we navigate today looks vastly different than it did even a few years ago. Federal agencies are under pressure. Budgets are contested. The regulatory frameworks that protect and enable rare disease drug development have been questioned. Programs that took years to build are no longer guaranteed to endure. And for families already living with uncertainty, whether that's medical uncertainty, financial uncertainty, the uncertainty of not knowing what tomorrow holds, this additional policy uncertainty is not an abstraction. It is another weight to carry. And yet, despite this, there are stories that remind us exactly why this work matters. In my career, I've met with parents after they found their child had a treatable rare disease through newborn screening. And the treatment existed, the screening existed because of exactly the kind of research funding and regulatory pathways that are now being debated. And these families did not use the term policy when they spoke of this. They used the word miracle. We all know these miracles, though, had a mechanism. They had an architect. And that architect was and is advocacy, which is why this week matters so much, which is why all of you matter so much. We are not here this week to panic. We are not here to despair. We have never been a community that despairs, because despair is a luxury the rare disease community cannot afford and, quite frankly, has never chosen. We are here to do what this community has always done, to show up, to tell the truth, build relationships across the aisle, and remind every member of Congress and every federal agency that behind every data point is a face, a family, and a future. This week, you will walk the Hill, and together we will have over 300 meetings with legislators. You will sit across tables from staffers and congressmen and women who may not know what Batten disease is, or galactosemia, or Friedreich's ataxia, or Sanfilippo, or any of the more than 10,000 other rare diseases. But you will tell them. And that is why today, Share Your Story Day, is so valuable. Because storytelling is not just a communication strategy. It is, in this community, one of our most powerful tools for change. Often, data is what opens the doors, but it's the stories that walk through them. When you sit across from a member of Congress or their staff and describe the 2 years you spent being told nothing was wrong, or the unimaginable amount of time spent trying to get access to the right doctors or the right treatments, that is not just an anecdote. That is evidence of either a broken system or a working one. That is the human truth that no spreadsheet or infographic can fully convey. Yes, research moves science and medicine. Stories move people, and people move policy. Your story is not a supplement to the policy argument. It is the policy argument. The specific, true, lived details of your experience are what make the abstract concrete and what make the bureaucratic personal. You are not illustrating a point when you share your story. You are making the point. So tell it fully, tell it with dignity, expertise, and the specificity that only lived experience can provide. Don't shrink it to fit the room. The room needs to expand to hold it. And I want us all to be very clear about one thing. We are not asking for charity. We are simply asking for a functional system, one that invests in science, that moves with appropriate speed and rigor, that doesn't abandon patients and caregivers in a diagnostic odyssey, or after a diagnosis is made, or before a treatment is found or administered. You are asking for what every American deserves, a fair shot. I will not pretend that this week will be easy or simple. The policy fights will be hard. There will be setbacks we haven't anticipated yet, but I have watched this community face the unsurvivable and survive it. I have watched you turn grief into governance, pain into policy, love into legislation. So this week, walk those halls knowing who you are. You are the people who have showed Washington what rare disease advocacy looks like when it is done with both heart and rigor. You are the architects of a better system. So with that, I will welcome you again to Rare Disease Week and excited to get to work. Thank you.
Hello, everybody. My name is Sarah Lloyd Stevenson, and I am the head of federal policy, health policy for Amazon. But more importantly, I am honored to serve under Amy's leadership on the EveryLife Board of Directors. I have been in health policy for about 15 years, which is wonderful, recognizing this is the 15th year of Rare Disease Week, and have had the wonderful opportunity to work with EveryLife Foundation across many different roles in federal government, as a multi-client lobbyist previously, and now as a member of the board of directors. I had previously served on the nominating committee for the Rare Voice Awards, and once upon a time, a long time ago, was actually very honored to be a nominee for a Rare Voice Award, but was not quite honored enough to get to that point of winning. Unlike the ladies I'm about to welcome to the stage today, who are some of the best amongst us, and I love that we're starting off this conversation hearing from each of them, because each of you are about to go off to tell your story with that heart and rigor that Amy talked about, and that confidence of a story that only you can tell with your lived experience. I want you to listen really closely to the experiences that each of these individuals have as Rare Voice awardees for 2025, because they're the ones who can really share with you how to get out there and get it done. So with that, let's begin welcoming our 2025 Rare Voice awardees to the stage. First, we have Emily Brubaker for Federal or State Advocacy, Youth or Teen. Next, we have Tiffany House for State Advocacy, Patient or Organization, awarded posthumously and accepted by her sister, Andrea Ferris. Next, we have the Foundation for Sarcoidosis Research for Federal Advocacy, Patient or Organization, and this is accepted by Mary McGowan, the CEO. And finally, but not least, Rare Disease Diversity Coalition for DEIA Empowerment, Patient or Organization, accepted by Jennifer Waldrop, Executive Director of Rare Disease Diversity Coalition. Wonderful. All right. First off, I know we just applauded each of them individually, but can we just give a big round of applause? These are our 2025 Rare Voice awardees. Congratulations, ladies. Thank you all so much for traveling from pretty far away, Alaska, for probably the farthest, to come join us today and share a little bit about your experiences. As I just mentioned, no pressure, but I do see each of you a little bit as the experts here in the room to share with our advocates who are about to storm the Hill kind of what makes advocacy work, what you've experienced that works well, maybe what you've experienced that didn't work so well. I think we'll have a lot more of the former because obviously you've done quite well to get here, or your organizations have. To that end, why don't we start off with brief introductions, as much as you feel comfortable sharing. Let's not get into too much of the advocacy first. Let's share. I'd love to hear a bit about you, your organization, or your rare disease journey, and what brought you here today. Emily?
Hello, everyone. It's so great to see all of your faces out here. It's always amazing to see what a great turnout Rare Disease Rare Disease Week always has. To introduce myself, my name is Emily Brubaker. I'm from Anchorage, Alaska, and I'm in 9th grade. I think that a little bit about my background in advocacy. I think the main way that I got into advocacy was through my parents. As a lot of people can probably relate, my parents are my biggest supporters, and I think that I wouldn't be able to do anything I do, advocacy or otherwise, without them. Another way...
Is one of them here in the room? Is your dad here?
Yes, my dad is here, Brian.
Hi, Brian.
I don't know where he is.
Sorry, I'm continue. He's here.
Yes, he definitely deserves that applause. So another way that I've really been able to have my advocacy make such a great impact is through an organization that my family is a part of called the National Foundation for Ectodermal Dysplasias. Through the NFED, my family has met hundreds of other very passionate and avid advocates, and through those connections, I've been uplifted, inspired, and supported. So I'm just very excited to be here today, and thank you all.
Hi, I'm Andrea Ferris. I am with the AMDA. I'm the director. We're the Acid Maltase Deficiency Association. I am honored to be here representing on my sister's behalf, who passed back in May. So I'm very honored and feel special to be able to be here to speak on her behalf and with all of you who know the journey. The Acid Maltase Deficiency Association works with clinicians, doctors, patients, families, and their caregivers really around the world to bring everybody together to unite our disease. As y'all all know very well, that your rare diseases are isolating and unknown, and it's easy to get lost, not be heard, etc. The list goes on. So having an organization like that to be able to carry on is an honor that we get to bring everybody together and unite and connect people in meaningful ways and to progress Pompe disease research and diagnosis.
Good afternoon, everyone. My name is Mary McGowan. I'm the president and CEO for the Foundation for Sarcoidosis Research. We're also known as FSR. FSR is the leading international organization dedicated to patient support, education, advocacy, and research. So an honor to be here. I got into advocacy actually because at a very early age, at the age of 5, I spent about a month in Sloan Kettering Cancer Institute. They thought I had cancer, and I was one of the very lucky children that did not have cancer that was there, but I did have a rare tumor. And although I didn't have cancer, I would go back to the clinic on an annual basis because my doctors were there. So I grew up around a lot of deformity and illness. And so I knew very early on in my life I wanted to speak up for patients, and I wanted to speak up for access to good care. And so I began my career at American Academy of Pediatrics for 18 years, and now I'm in the rare disease space, and honored to be here to collaborate with everybody in this room. Thank you.
Hi, everyone, and hi, everyone to that side of the room. Hi, I'm Jennifer Waldrop, the Executive Director for the Rare Disease Diversity Coalition. The Rare Disease Diversity Coalition, otherwise known as RDDC, is a program within the Black Women's Health Imperative. The Black Women's Health Imperative is a 40-year-old organization. The RDDC came about 6 years ago now because of organizations like EveryLife who felt like there was a place in the space to help the underserved population, the rare within the rare. So our area of focus is very similar to many of just spoke. We focus around the areas, obviously around policy, legislation, advocacy areas, but we also have other areas of focus when we know that the underserved populations, underrepresented populations are not a part of the clinical trials. So we're doing some work in that space. And of course, the patients, the caregivers, the providers, the delays in diagnosis that happens to the rare within rare communities, that is also a huge area for our focus. So I'm so delighted to be here today because we're a pretty young organization, and for us to actually receive this award, I am so honored and touched. And this award was nominated by somebody, so I'm just going to say it. Thank you to whoever who did that for us. We really are surprised that we are sitting here, and I'm just so delighted to be able to represent this community for the rare within rare, so thank you.
Wonderful. All right, so each of them or their organizations have been awarded because of the wonderful work they've done on behalf of their communities and the broader rare disease community. So I'd like to dive a little deeper, and let's hear a little bit about what advocacy means to you and what your goals, what your strategies have been. So Emily, as the youngest and the one, as I mentioned, who came from the farthest, I believe, what can you share about advocacy, what's important to you? And I'd love to hear a little bit, too, about your work with the Ensuring Lasting Smiles Act.
Yeah, I'd love to share that. So, since 6 years old, I've advocated for a bill in Congress called the Ensuring Lasting Smiles Act, or ELSA. This bill would cause medical insurance providers to cover the costs of treatments for people with congenital anomalies and conditions. Under current law, insurance companies do not cover these treatments and procedures, as many of you know, which of course can cause a sometimes insurmountable barrier for people who are just wanting to get the help that they need to live normal lives. This makes my advocacy incredibly important to me because of the potential impact that I could have on not only my family, who is affected by rare disease and the costs that come with having a rare disease, but also the millions of other families across the country who are impacted. It's also very important to me because, as demonstrated in this room, I can represent and work with thousands of other individuals who also have rare diseases like mine. So I was born with a condition called hypohidrotic ectodermal dysplasia, and that, of course, means that I'm facing a lot of medical costs, especially dental, when I'm older. And under current law, as I said, insurance companies won't cover any of it. So as an advocate and as a youth advocate, I'm working to close this loophole in federal law that allows these insurance companies to not cover what is, of course, medically necessary for me and other individuals to basically survive and live a normal life. It's just so important to me that everyone has the opportunity to function as regular people in society, and I think that it's just so inspiring that everyone here in this room has shown up, because it shows the resilience and the determination that the rare disease community has.
Wonderful. And I think many of us can relate to, not only do we want to advocate for research and approval pathways at FDA, but at the end of the day, access is what really matters, whether that's a treatment, a therapy, a surgery. And also, for those of you in the room who are wondering, how is this 15-year-old so articulate and impressive? Mind you, she is, and she is a 2024 National Civic Speed champion. So let's give her a round of applause on not just her advocacy, but so well done, Brian, wherever you are. And I hope, too, that our younger advocates in the room, I want to say kudos to the parents who have dragged your kids out here for Rare Disease Week. It really is impactful, especially considering how many youth are impacted by rare diseases. I hope you're all listening to Emily and that she can inspire you as you go out this week. So thank you. Andrea, Tiffany, I'm so sorry about the loss of your sister, Tiffany. And I have to say, she was a wonderful advocate, not just for the rare disease community, but Pompeii. She did wonderful things, newborn screening, RESP alignment in Texas, but much more. What can you share about how you're carrying on her legacy every day with your organization? But what do you see from her experience and her getting this award that you would like to share today?
Yes, my sister was incredible. Thank you. She was a very powerful force that wasn't afraid to get in there and do everything that needed to get done. I know that started with my parents, who are here, my mom and my dad. They went many years without a diagnosis. It was difficult to get a diagnosis. They were told, there's nothing wrong with your child, get out of our office, to, we don't know, who knows? And then when they finally got a diagnosis, it went from, it's Pompe disease, there's no treatment, she's going to die before she's 20. And my parents, who are the amazing fighters that they are, and I tell my own kids that I just hope that I can be as amazing as my mother one day, didn't give up and continued fighting. And my sister saw that, and we saw that as her sibling, that you don't give up. You keep fighting. You show up consistently to make change. my mom started the AMDA, the Acid Maltase Deficiency Association, to do just that. We realized that there were doctors and patients around the world working that were not communicating. So we started an organization, and we have a conference every 4 to 5 years for doctors around the world to get together and share what they're finding, share what they're working on, sharing what they're doing, so that it's not just one lone person not knowing that something else great might be happening over here. They did all of that. My sister carried that on, and now, like I said earlier, I'm honored to be carrying that on in her place as well. But she saw a lot of gaps as well. She saw gaps in being isolated. As many of you here know, your rare disease is probably isolating. There's not very many people in your community or your school or wherever that are going to have the same disease. She didn't have friends who had this disease or even heard of it, let alone doctors who had heard of it. So she started through the AMDA webinar that we have monthly, where we bring experts into everybody's home to educate on Pompe disease, and patients, caregivers, their families, doctors can ask questions and get answers from the experts. We also started, my sister started the Talking with Your Pompe Peeps, which was she chose that title to be fun and relaxing because it was a community group for everybody to come together, mainly patients and caregivers and their families, to talk openly, to feel like, hey, I'm struggling with this, I have this pain, I'm dealing with this, this, or this, whether it's personal, social, or economically, or something with the doctors. And they were able to talk and communicate and feel like, okay, there is a team, we do have connectedness, which was extremely important. My sister saw that gap. She also worked with the International Pompe Association, so she worked globally. She worked with doctors and clinicians, truly changing treatment outcomes for other patients. She's also published, and she discovered, designed the Pompe model, which essentially taught patients that their voice matters, that your voice as a patient of a rare disease can actually change the way a rare disease is diagnosed, the way it's treated, the way future treatment needs to evolve to make a difference in the future of those patients' lives. And she did have a big hand in the newborn screening. I know that stemmed from my parents having such a difficult time getting diagnosis, from hearing things that are heartbreaking to even repeat. So having a newborn screening and being able to be diagnosed at infancy, changing the outcome of their life if they can start treatment, and there is a treatment now. There's now 3 approved drugs. So if they can start that treatment earlier, they have a better outcome for their life. But she saw gaps and she filled them. So I did want to share that if that's something that for me has been inspirational, because while we are meeting with legislators and we're doing all of these things, in your own community with your rare disease, if you see a gap, fill it. My sister saw, I wish I had this, I wish I had that, I wish I had somebody to just talk to, for somebody else to say, oh, I get that pain too. Or, yeah, I've explained to my family 20 times why I can't do X, Y, Z, but we still don't fully understand it because we don't live with it. So she created those groups to be able to talk to other people. The webinars and the Talking with Your Peeps was something near to her heart. So the AMDA she was very, very proud of. And then she worked with clinicians and doctors all around. But if there's a gap, fill it. Even if it's just in your own community. She also started grants where just in her own hometown of San Antonio, Texas, she started a research grant that has raised over millions of dollars over the years, just to fuel Pompe research. And she just did that through San Antonio, doing most of the work on that. So if you see a gap or you're wanting more research, there are things you can do, and you don't have to figure it all out and do all of these millions and billions of things that she did, because I could write a book on how much she accomplished. That was just a couple of highlights in her life. So you don't have to have a million things overnight. It's okay to just fill a gap, one thing at a time that you see in your community or your state, and tackle those things, and you can do it too.
Wow. That's a wonderful message of filling the gap, and especially in that community piece, even from your local community in San Antonio to international. So
Yes.
I know that your mother is proud, and you should be, in your family, for carrying on your sister's legacy.
Thank you.
And you said you want to be as great as your mother. By the way, Andrea has, I learned, 4 children who I believe are all here today
I
as
do,
well.
yes.
So
Yes.
well done on making this continued
Thank you.
family affair and
Thank
truly
you.
a legacy. So thank you for being here.
Thank you, I'm honored.
I know we could spend the entire time applauding each of these ladies. It's really wonderful to hear from them. To that end, Mary, FSR has had some wonderful initiatives over the years, and under your leadership, the advocacy has truly been fantastic. I'd love to hear a little bit from you about engaging with congressional offices to get a change from the regulatory side. A lot of times we may not think of that, okay, this is I need a regulatory change. I should go to Congress for that. Can you share a little bit about your FMLA experience?
Yeah, sure. Happy to. So I'm going to share the story about how we were able to recently have a change to the Family Medical Leave Act in America. So I don't know if anybody here knows this, but we were able to work with the Department of Labor and Congress to make it so that the 60 million Americans who are in the workforce and eligible for FMLA, the change is that now if they take time off to enroll in a clinical trial in America, their job is covered under the FMLA, as is a family member caregiver. So this, no doubt, is going to have incredible just impact in America on all chronic diseases and clinical trials. So very exciting news. But I just want to share a little bit of the background on how that happened. So sarcoidosis is a disease of disparities, really impacting the African American community, and especially African American women. 3 times more likely to get sarcoidosis, 18 times higher hospitalization rates, 12 times more likely to die of sarcoidosis, and they die at a younger age. Staggering statistics that I could go on with that community. So we really wanted to do something about this. So we put a national campaign together called Ignore No More. The campaign was focused on the African American community as well as clinicians, because we wanted to really get the word out that clinicians should really be looking out for sarcoidosis in the African American community. Anyway, it was a 5-month campaign. It was extraordinary results. We had 26 partners on this campaign. We had over 500,000 media impressions in this 5-month period, raising awareness in the nation about sarcoidosis. And so after that, we wanted to move into phase 2 of the campaign, which was focused on clinical trials. Again, with the high incidence of the Black community in sarcoidosis, we wanted to find out how we could enroll more of the Black community in clinical trials. And in order to do that, we needed to understand what are the barriers. So we put together a national IRB-approved survey. We sent it out in a press release to the entire nation, calling out to the Black community who are living with sarcoidosis. Please take time and complete the 52-question questionnaire. Our goal was to have 200 responses. We were amazed. We had 406 responses. We had very robust data now. We put together a key opinion leaders thought workshop to take a deep dive into the data and to come up with recommendations on how we can make change associated with these barriers that were identified. Then we put together a patient focus group. They too looked at the data, they came up with their own recommendations and also commented on the KOL recommendations. We put all of this in a white paper, 60-page white paper. We released the white paper at a congressional briefing, and at the briefing, we made the statement because we knew fear of job loss was the number 3 reason why the Black community was not enrolling in clinical trials. They were losing their jobs. So we knew we wanted to change the FMLA. Well, we hired some lawyers who were very smart and said, this is the way we're going to do this. We're not going to ask the Department of Labor to change the FMLA per se. We're going to ask them for clarification on this because there was a loophole in the language around therapeutic benefit for clinical trials. So we wrote a letter. We did not get a response back. We were not getting a response back for over a year. During that year, we put together a coalition, which is now over 40 members strong. EveryLife Foundation, thank you so much for being a member of that coalition. Jennifer with RDCC, also a member of that coalition. We got the coalition members together, and we went to Capitol Hill, and we had over 40 congressional visits. And we said to Congress, we need you behind us. We need you to help us get this over the finish line so that we can get a response back from Department of Labor. Shortly after doing that, lo and behold, we have a 6-page letter. If anybody's interested in looking at it, it's on the FSR website, that now states in America, again, the 60 million Americans are now, their job is protected, as is a family member caregiver. So it's a great example of showing the power of Congress and Hill visits. And one more thing, if I can just quickly say this. So we just launched what is called Champions for Change. We are asking companies and organizations throughout America, please provide at least 1 day paid leave for anyone who enrolls in clinical trials. And we're asking everybody here to please join us, because when we do this, we start the conversations in corporate America, and we support those who are enrolling in clinical trials. So thank you.
Thank you. Again, that gets back to, as we're talking about the access, but also the necessity and importance of clinical trials for that research piece, all the way at the beginning from bench to bedside. Jennifer, you've been patient. We have been hearing wonderful stories as we get down to you. Your organization every day works to improve access and understanding for individuals and communities who are marginalized, who are underrepresented. Can you share a little bit about how you've taken that work and translated it into advocacy, and specifically by supporting the introduction of legislation?
Sure, thank you. Well, this is a tough act to follow. Amazing speakers ahead of me and amazing work. I'm so privileged and honored to be amongst these amazing awardees. So at the RDDC, we start really from a simple truth. We know that rare diseases are not experienced equally. I'm sure those in the room, so many of you have personally experienced this. Communities of color, the rural patients, low-income populations, they're often faced with longer diagnostic delays because there's fewer clinical trial opportunities and they have less access to specialists. As I say that, I'm sure you're thinking about your own stories, whether you or you act as a caregiver, for example. Those inequities are often compounded in the already difficult realities of living with rare diseases. So you have the normal behaviors of living in rural populations, but then you've been diagnosed, if you're so fortunate to be diagnosed, with the rare disease. At RDDC, our work is truly grounded in the understanding of this health inequities that's in our system here. As alluded to with my previous speakers here, we have we've got a lot of issues with some of the rare disease communities in terms of the way that they are treated. And so when we looked out for RDDC, it was very natural for us to determine that where are the opportunities in our system to improve it. We looked at the various gaps from the healthcare perspective. We heard and listened to many of the folks that are part of our community and really tried to identify opportunities there so that we can narrow those gaps. And that's the point of some of this policy work, right? These stories that we hear, the lived experiences that you all have, there are gaps in our system. So last year, on Rare Disease Day, we were so fortunate to actually have a sponsor, Marilyn Strickland out of Washington State, sponsor the HERD Act. It is HR 1750. The HERD Act means Health Equity and Rare Disease Act. This act was put together because of the many stories that we heard, because of the data that RDDC had collected along with some of our partners, so that we knew that there are some issues that we as an advocacy organization could help minimize. We convened with patients, we convened with clinicians, researchers, and put together some of these opportunities here so that we can really hone in on the minority populations. The insights that we pulled in together created this bill. Basically, this act was shaped directly by the community voices from those that we've been able to connect with. We listened, we researched, and we partnered. And so in order for us to do that, that's how we came up with the HERD Act. So what's in the HERD Act, and what does that mean for you? So if you're not familiar with the HERD Act, there are a number of different areas of focus for us. One, let's target federal research investments so that we can better understand rare diseases that disproportionately impact these underserved, marginalized populations. Two, let's look into improving data collection. We know that for a fact that we need to do better in this space. Patients are diagnosed, we want patients to be diagnosed earlier and counted in the research. Andrea's sister and her story is an example of this. We can't do this without workforce and the backing behind that. So let's diversify our workforce opportunities. Let's include training. Let's target some populations that look like the communities that we're trying to serve so that we provide incentives for folks to go into the rare disease communities. Fourth, let's do this work together, community base it. But let's also focus on one really niche population that we haven't talked about today, which is the Native American indigenous people. They are the backbone to America, folks. Let's ensure that the data that we collect is relevant to them so that we can better serve this community. Let's make sure that the research that we do, the engagement that we do with this group is culturally relevant. That information is super important because they operate in a different way than perhaps I do. So I need to be sure that when I work with the Native American population that I'm culturally relevant and understand that. And it's okay if you don't, but let's be humble about it. And fifth, transparency. Transparency is so important in this work. As you all know, working with NIH, CDC, et cetera, it's really important that we are more transparent in the way that we're collecting this data, how we're utilizing this data. We want our federal agencies to report on their progress and really encourage them to really have a real focus on equity in the research. So the HERD Act really says one couple of different things. One, we haven't done this before. We haven't really focused on certain populations. We haven't done a whole lot in encouraging folks to go into the rare disease community specifically and make a huge difference. Two, this policy came out of information that we heard from real families. As Amy mentioned earlier, we heard about stories, not just moving mountains, but also moving the policy and the laws out there. So when we've collected these stories from parents who spent a decade searching for a diagnosis because providers didn't recognize symptoms in darker skin colors and skin tones, that's a problem. We've met with patients who couldn't access clinical trials because there was no other study sites near their communities. I'm sure some of you are feeling that. I'm thinking of one caregiver right now who's going through clinical trials. She may be in the room, and she has to travel with her daughter who's nonverbal. And we work with advocates who saw therapy is approved, but unavailable to them because of insurance or geographic barriers. These lived experiences were taken into consideration when we put this act together. We're so grateful for Congresswoman Maryland to be able to do this, and we're so delighted that this time last year that Congress recognized it and we have a number associated with it. Ultimately, the HERD Act was created because of so many of those in the room here today. We want to be able to use this rare disease policy to be able to help all of the folks because we know that those people that we're looking into also impact the folks in this room. They impact us from a community level because this is America, folks. So rare disease patients already have enormous changes, and they should not have these other barriers as well. So no matter the race, their income, or their zip code, we want them to have equity and equality in their lived experiences. So that's sort of how the HERD Act came together, is because of the communities that we serve.
Wonderful. Thank you, Jennifer. Now, admittedly, I have no idea how much time we have left on the panel. Okay, we're great, we're good. What I would love to do here, because we have, as I've already said, our best rare voices of 2025 represented here on today's panel. And in front of you, us somewhere in this room, are perhaps our best rare voices of 2026. So I want to do a round robin here quickly and go to each of you to ask, as these individuals out in front of us are about to go lobby, advocate to Congress, perhaps administration, what guidance, what tips do you have for them to share before they go pound the pavement and share their stories? You go first, Emily?
Of course. Well, first of all, I would like us to acknowledge again everything that all three of these amazing women have said. It's just so incredible. Can we give them another round of applause?
And you.
Well, as an advocate, as pretty much a lifelong advocate, I have definitely, I would say, had some experience. And I think that while we all have a lot to learn still ahead of us, I think some things that I have learned I would love to share with everyone else in this room. So, in my experiences, the most effective way to get legislators, staff members, agencies, anyone you're advocating for, to really listen to you and to be convinced by you is by just being yourself. Sharing your personal story, sharing that you're consistent, you're persistent, you're passionate, those are all just incredible ways of getting people to realize that you, a real human person, are passionate about something and you believe that this should be just the norm for everybody else. So I've done this, I hope very effectively. And I have had some successes as an advocate, as just a regular person like most of you. I have worked with my family, other advocates, other people with rare diseases, and I've gotten to pass resolutions in the Alaska State Legislature and the Anchorage Assembly that support the Ensuring Lasting Smiles Act in Congress and that urge Alaska's congressional delegation to co-sponsor ELSA. And I think that that's a really great success for the state of Alaska because I'm always representing my state, which is so often underrepresented. But I've also managed to, alongside my family, other advocates, it's not all me. I feel like I owe a lot of my success to other people. We've managed to get the Alaska Congressional Delegation to be the very first congressional delegation to have all of its members co-sponsor the Ensuring Lasting Smiles Act. I think that all of these successes, along with the successes that everybody has while they're going to be advocating on Capitol Hill tomorrow, will amount to so much. It will be so much that I don't think we can even comprehend it right now. But I'm just so excited that all of us are going to be on Capitol Hill, and just by sharing your own personal story, by being yourself, that's the best way that you can be an advocate for change. So thank you, all of you.
I think we can all agree with that, and something that I often say is leave your personal politics at the door, because this should be bipartisan issues, but bring your personal story to the staff member or the policymaker. Andrea.
I would completely agree. Your personal story matters. I have seen through many different avenues, a lot of data and charts and this and that sometimes are very difficult to read myself. But I've heard personal stories, so yes, what you said is absolutely true. I've heard stories that even knowing the Pompeii community and what they're going through and what's happening, that have made me cry. So definitely go in with your personal story. You can make a difference by moving somebody emotionally. And that's honestly a really good way to make them remember you. They'll remember your face. They'll remember what moved them. And also, I would say give yourself grace. You might go in and you might not get the answer you're hoping for, that you've been praying for, that you've been wishing for. That's going to take time, and that's okay. So do not feel like if you didn't get the answer that you wanted or the outcome that you wanted today, tomorrow, next week, next year, etc., that it's not going to happen. I can say from my sister's life, she passed when she was 42 years old. She made more change in her 42 years than most of America will make given 100 years. And she's going to continue making that change because of all of the things that she did, because of all the paths that she took, all the people that she spoke to and was brave enough to. And I'll tell you, she was not one for public speaking. She hated it, would always tell me that she was nervous, and she got up and did it anyway. So even if you don't feel prepared, or you don't have special letters behind your name, or you don't have a special title before your name to walk into that room, you still belong there. You still matter. The reason you're there is because of your personal story, your lived experience, and you have a voice, and that voice matters, so use it. She did, and I know that in the next 5 years, 10 years, 20 or 100 years after my sister, change is going to be seen that she's not going to get to see. There might be change that you don't get to see, but you're making for the next generation or the generation after that. So show up. Be confident in who you are, go in respectfully, and make your voice heard, because your lived experience is what matters. It's what's going to make change. And like many of us have talked about, we have already seen a lot of change, and I think, like Amy said earlier, we still have a lot of work to do. We see it in the Pompeii community, and I know that you all see it in your communities as well. So keep showing up, but give yourself grace that it might not be perfect the first time or the 10th time, and that's okay. So be patient, but don't give up, because change happens when you show up consistently, fighting, doing what you know is right for yourself, for the person you're fighting for, or the community you're fighting for. Just keep showing up.
Wonderful. Agreed. Give yourself grace. I like that. Be persistent.
Got to.
Especially in this environment in DC may seem very partisan and hostile at times, but truly you can find those silver linings in that space of what I call purple to get things done in bipartisan. Yes. Mary, would you like to add a tip?
Totally agree. There is nothing more powerful than a patient story. I mean, I could just share that just as being CEO of a patient advocacy organization. Like Andrea was saying, I can get up and talk about the statistics and the charts and so all the information, but it's never as meaningful as it is when a patient is there sharing their lived experience. So these congressional offices want to hear your stories. Federal agencies also want to hear your stories. At FSR, we were able to put together a patient listening session and then a patient drug development session, and it was all about the patient stories, and it really drives change. And so I just wanted to re-emphasize that. And the second thing I would say is build a relationship with these offices, right? It's not a one and done. It's great to share your story, and again, so critically important, but don't stop there. As follow-up, continue to send information when something happens in your disease state, or whatever it is that you can keep them engaged. And maybe it's something personal. Maybe you have in the conversation something in common with the staffer that you're meeting with, or the congressperson that you're meeting with, right? Don't underestimate that. That can be very powerful. So my recommendation is to look at this as building relationships. And these are relationships that are really important because they can lead to extraordinary things. And it's through the power of the patient story. And just thank you so much for everybody who's living with a rare disease on doing this week, because it's not always an easy thing to do. And but again, the power in that story always leads to extraordinary things. So we thank you for being, really passionate in sharing your story. And also understanding the power of the voice that you have in making change. So thank you.
Absolutely. I think we cannot underestimate that importance, that it is a marathon, not a sprint. Mm-hmm. It is not just the story you're telling over Rare Disease Week. It is the story that you're telling this week, and then that you continue to tell and to follow up, even just sending a staff person a simple thank you message afterwards, because they are an revolving door. They are having meeting after meeting after meeting. You be the one, the 1.5 hour meeting that follows up with them a week later to say, thank you for your time. As a reminder, this is what we talked about. This is what we want. How can we help get it done? Such excellent points. Jennifer.
So let me dovetail a bit on the staff story, meaning that this is my 4th time going on the Hill thanks to EveryLife. And I'm going with my state, and I'm super excited. And I saw on the schedule the same staff person that I think I've been seeing for 4 years in a row. Last year, honestly, I only see him once a year. He was like, I remember you. And I was like, oh boy. Which was a good thing, right? And so to your point, it's like, absolutely, these are human beings, and the staffers are very influential in their offices. And they remember you, and they want to hear your stories, and they want to know what's new. So as you're making that ask for the 50th time to remember they are humans on the other side. So they really do. I think it's a big piece of it. The other piece of it I wanted to also underscore is your story matters. And not only are the current folks in office remembering your stories or moving the needles because of your stories, I have talked to so many folks that have retired from Congress, and they say the same thing. Why did they support that bill? Why were they a sponsor for that act? It's because they heard the stories from the patients, their caregivers, the community, and that is what's moved them. So that information continues to trickle down. That is not the line that they're drawing me. They're done. They're in office, but they're still saying that is exactly what happened. So your stories really do matter. There's a reason why we're doing this work. And then the last story I want to share is more recently about the nonpartisan and about the way that some of our policymakers operate. I was in a roundtable with one of a congressman, basically, and he really wanted to hear the situation. He wanted to hear the data. He wanted to hear the scenarios, but he also wanted the solution. So as we talk about being nonpartisan from a political perspective, please also don't whine to them. Come up with the solution. And that's really, they're also very interested in being a part of the cause and being part of the answer. So again, they're willing to partner with you in many ways if you come up with a solution that works for, of course, for their agenda. But I just wanted to just underscore that nonpartisan piece as well and a solution-oriented.
I love that. I think that's a wonderful way for us to end. Let us all, I know we are so tired of applauding already, just here at the beginning of Rare Disease Week, but as we thank these ladies, thank you so much to our Rare Voice, and congratulations, our 2025 Rare Voice awardees, and I look forward to seeing some of you on this stage accepting the awards next year. Thank you.
Thank you.
Good afternoon, everyone. My name is Stephanie Reardon. I am the Senior Director of Patient Programs at the EveryLife Foundation. I have the privilege of running Rare Artist. Today is our first ever Share Your Story Day as part of Rare Disease Week. So it's a day really focused on how we share our lived experience. When we hear share your story, oftentimes we think about elevator pitches or legislative meetings, but this session invites us to, quite literally, paint a different picture or even play a different tune. Creative expression allows us to share our lived experience in ways that resonate differently. And that is the heart of arts and health. It's a growing field, recognizing that creativity strengthens well-being and connection. And for a community like ours, where isolation and long diagnostic odysseys are common, that really matters. Art, as you see on the screen, some of our 2025 entries, art can translate often complex experiences into something others can see and hear. It can reflect barriers to care and the reality that 95% of rare diseases do not have an FDA-approved treatment. That's really the heart of Rare Artist. Established in 2010, Rare Artist is a national advocacy program where individuals impacted by rare disease transform their lived experience into public impact through art. In a few minutes, you will hear directly from some Rare Artist awardees who live this each and every day. But before I get to that, I would love to recognize our 2025 Rare Artist awardees, many of which are in this room right now. We received over 200 entries this year, and these 10 awardees stood out for their powerful advocacy through art. If you are here, feel free to stand if you are able to when I call your name. In the music category, Alex Yu. Sophie Seaver. Zanny Nicholas. Zanny, I know, is here. Oh, over there. Perfect. Poetry, Maria Fernanda Yave. Visual art, Beatriz Fraga. Denise D. Marshall. Eva Agus. Krista Webb. Solana Acuna. And Y.A. Hugh. Y.A. recently gave birth to a beautiful baby girl, Gloria, so Y.A. cannot be here today, but she sends her thanks to everyone for being here. To better showcase all of our awardees, please enjoy this video highlighting our awardees.
Rare disease advocacy is when you are willing to open up, you kind of become vulnerable and you share your story, the low and the high, just educating and spreading awareness that we have purpose in life too.
It gives me an amazing opportunity to advocate for patients who, like me, live with a rare disease. And now that I'm part of this community, I find my disease isn't as rare. There's peace and community in numbers.
The journey itself and the courage that every one of the rare disease artists that I have met has been this testament of being able to soar, being able to be unbroken. Art has a place in healing and the therapy and the recovery for rare disease patients.
Since I've entered my art in this competition, I've learned so much about how art can be used as a form of self-expression, and it's taught me to possibly make more art like this in the future.
Being someone who has a family member with a rare disease, not a lot of people talk about that experience, and I think making art that talks about that experience is really important, and I think art can also be a very important way to advocate.
A lot of my drawings and my paintings always give me like this sense of my life and my sister's life and how that's different from another kid that doesn't have our diseases.
I really just tried to write not only just my experience with a rare disease, but tie in advocacy, talking about different systemic things that people with disabilities go through, like gaining access to healthcare. So winning Rare Artist and being recognized, getting that award, it meant the world to me.
It's so meaningful to me to be a rare artist because the time period when I entered this, I was at a very low point in my life where I was struggling physically and a bit mentally, just accepting everything. And this has definitely given me some self-confidence, and it's also given me a community of people that I think are amazing in their own right, but they're also giving me a lot of value in my new existence.
Years ago, when he was still verbal, he at one point came up to me and said, "Never give up." And that's one of the things that I remember most of him saying is never give up. And so Alex's message would be to everyone to never give up your dreams, finding joy in what you do.
Being a rare artist to me means having a voice. Just draw your soul out. It doesn't matter if it's good, it doesn't matter if it doesn't make sense to other people, as long as your feelings are on that paper, it's art.
Thank you. Before we move into the panel, Denise D. Marshall, one of our 2025 awardees, is still en route from the storm, but she did ask me to pass along a message to please always remember that art is society's empathy muscle. It must be exercised daily to strengthen it and keep it strong. As an artivist advocating for the rare disease community, I hope my art makes people stop, pause, and see one another, this beautiful rare disease community. We are incredibly fortunate to have Lisa Sims Booth here with us today to further this conversation. Lisa has served as Executive Director of the Smith Center for Healing and the Arts here in Washington, D.C., and serves on the Board of Directors for the National Organization for Arts and Health. Please join me in welcoming Lisa.
Thank you so much, Stephanie. I'm really delighted to be here. And earlier in my career, I spent 14 years in the medical research space at Faster Cures, working to advance treatments and innovation. But at the same time I was in that role, my mom was diagnosed with cancer. And it was that navigating that experience that I've learned firsthand how art can be a tool for healing, how it can be supported, and what a powerful way we can share lived experience. And that experience ultimately led me to the role I have at Smith Center for Healing and the Arts. And every day, I see how creativity helps people process illness and tell their stories. So I was thrilled when Stephanie reached out. I think the email hit, and I answered her a minute later, like, yes, I'll do whatever you want, because this is near and dear to my heart. So I'm excited to be here to help lead this panel and to be with these amazing artists. And we're going to begin first with some brief introductions from each of our artists, and then we'll move into conversation and some audience questions. So first, please join me in welcoming Nell Choi, a 2022 and 2024 Rare Artist Awardee from Virginia, recognized for her ceramic pieces, Elephant in the Room and Twist of Life. So we'll take her on now.
Hi, everyone. I first have to say I'm just so happy to be here. It feels like a family reunion, and I'm spotting all these familiar faces and also new faces in the crowd. But as you said, my name is Nell. I have neuromyelitis optica spectrum disorder, and I was diagnosed when I was 9. And I would say that it was a pretty scary time. I suddenly lost the ability to walk, move my right arm, and I think that's when I actually really turned towards art, and specifically clay, because when I was in the hospital, I couldn't hold markers or pens or any of like the stuff they give you in those little goodie bags, like from Child Life and everything. But then the art therapist handed me a thing of model magic, and that's when I began sculpting. And so 2022 was the first kind of introduction into advocacy when I submitted the Elephant in the Room, basically to show that there's so much. It's always like living with a disease that's invisible to the other people is something that no one else really understands, and it's so hard to talk about. And since then, it's become such a vehicle for my advocacy, and yeah, I'm super excited to be here today.
Thank you so much, Nell. And now we'll please welcome Wes Burian, a 2022 Rare Artist Awardee from Oregon, recognized for their digital piece, Sprout.
Thanks very much. Yeah, good to see everybody here. Travel is not something that is easy for us in the rare disease community. I think we should recognize that. And I flew from Portland yesterday, and it was a long flight, and took some time to recover, and I'm happy to be here now, and thank you all for making the trip. I grew up as a little boy in a smallish town in Canada, in British Columbia, and all I wanted to do was make movies, play with little Star Wars toys and the like. I was a Star Wars kid. And I didn't know how to get to Hollywood, but when I was 22, I took a chance and moved down to the United States, to California, and didn't know what I was doing, but I had always been drawing and sketching and always being told I had talented art. And I got a job doing some video game work, which led into some motion picture work in feature film. And then I landed at DreamWorks Animation, where I was an art director and department head for 15 years, mostly doing pandas doing kung fu and stuff like that. I created some of those characters, most of those characters, and for that series of movies. I was diagnosed around the time that I moved down to the States with Fabry disease, all of which I had known since I was a kid. I was different, but it was just kind of like, you're weird, you're something's with you. Well, that's just Wes. He can't walk very far. He can't sweat. He has heat intolerance. He needs to be always close to a bathroom. He has trouble with pain in his hands and feet. But they're growing pains. They're stuff he'll get through, and the doctors sort of like that I was always at were just sort of explaining things away. But I was diagnosed through a family member in England, and ever since then, that was back in about the year 2000 when I was diagnosed, and I've lived with this disease, which is Fabry disease, a lysosomal storage disorder. When you get diagnosed, it's like a light bulb, and you feel relief, but then you feel the heaviness, and I think we've all experienced that in this room. And now I try to use my art. I retired, went on disability back 7 years ago when I could no longer complete my duties at DreamWorks, and I just felt it was time, and the doctors were saying it was past time. So that was about 7 years ago. Now I try to use my art as advocacy to communicate things that there's a lot of people that don't have a voice. There's a lot of people who couldn't do the travel that aren't in this room too. And I think we could think of dozens in our own communities that couldn't make a trip like this. And I just want to give them voice too. I want to give people who aren't as confident in their creativity to get out there a voice. And I think that art can be made by anyone as well. I think you put something down on paper, on your phone recorder, on any source of media, and that communication from your heart is going to be art. I think we're all artists. So with that, I will just pass it along to Krista. We're back to you.
Thank you, Wes. And finally, next welcome Krista Webb, the 2025 Rare Artist Awardee from Texas, recognized for her wood-burning piece, Imperfect Pathway.
Hello, my beautiful friends. Happy to be here. My name is Krista Webb. I live with a rare condition called Usher syndrome, which affects both hearing loss and vision loss through retinitis pigmentosa. And despite living with a dual sensory loss, I become an advocate and a wood-burning artist. And I want to talk about my art piece that is showcased today. If you haven't watched the video yet that Rare Artist has shared on the website, I'll give you just a quick summary. There's a blind man that's walking with his white cane, and underneath a tree branch, a skinny branch, sits an elephant. And so the question I ask you is the elephant real and the man simply can't see it? Or is the elephant something only the man is aware of? And that uncertainty reflects what it's like to live with a rare disease. The people around you often can't see what you're experiencing, and they question it. You become the elephant in the room, misunderstood, and others often feel uncomfortable due to your condition. And because of that, many of us are left navigating an imperfect pathway. Rare disease patients wait an average of 5 to 7 years for a diagnosis, not because the condition isn't serious, but because too often people are still debating whether the elephant exists instead of asking how to carry it. And today, we're in a room full of people who see the elephant.
Thank you all for those introductions and for giving us a little glimpse into your vision and what powers your work. And I'd love to open up this question for all of you is just, how has living with a rare disease shaped you as an artist? You've already given a little bit of that, but I'd love to hear a little more from you. And any or all of you can jump on that.
Well, I'll go ahead and answer that question. If it wasn't for my condition, I would not be a wood-burning artist today. I didn't talk much about my story just now, but I'm 38, and I was diagnosed with Usher syndrome at age 19. And I didn't become legally blind until I was 31. So shortly after that, I learned about wood-burning art. And once I learned about it, I couldn't stop learning about wood-burning art. And it was a domino effect, like a ripple effect. And I eventually connected with people all over the world on social media, learning about other artists' disabilities. And it's been wonderful. And every day I'm learning about new conditions and how to be better advocates.
Yeah. Yeah, I think an artist is something I define myself as, and I think I always have been. And I think there's a, like I alluded to before, there's a part of that we can all be. I think I've used my art in a commercial setting, my previous career, but now it seems that using my art to communicate things within myself about my disease that I can't necessarily voice is a really direct way to communicate to people. And I think also art can be met with less resistance from viewers. It sometimes slices through to the core of people, and they realize they're having emotions they didn't even know they had. Whereas if I just put it down, trying to communicate it another way, I don't think it would be as direct. So that's how I think I could use art, how it's influenced by my disease.
All of what Wes said, I totally resonates with me. I was going to take this question from the perspective of being a high schooler living with a rare disease. It's something that when you talk about it, you'd be like, oh yeah, I had that infusion yesterday. I just get these, regularly. It doesn't carry the same weight or depth. It just like kind of floats away in conversation. But I think for me, creating art pieces is like an invitation or a window into my experience per se. And it invites like my peers or my friends or just anybody looking at it to ask questions and show them that it's okay. It's not something that has to be the elephant in the room that we're afraid to talk about. Like I want them to understand, and it's less maybe intimidating than, giving my whole spiel about what neuromyelitis optica spectrum disorder is.
Thank you. No, actually, that is. Go, we can clap for that. Yes, we can clap for that. No, you gave us a great segue into my next question, and that is for you and for Wes. You've both been to Rare Disease Week before as an awardee. And so how was it when you brought your art into the Hill meetings? How did that help shape the conversations you were having?
So I have a friend who makes T-shirts down in Ventura, California. I sent him my piece of art, and he sent me back T-shirts of it, which was kind of cool. So
that was
last
the coolest thing.
Yeah. It was in 2022, I guess, if I can remember that far back. And I had a picture. I had my artwork on my chest here on my T-shirt. And so I would go into the meetings, and I would say, here is the piece of artwork that I created as a rare artist awardee, and they could see it, whether it was, right here or I had it on a piece of paper. And I basically told them that I could inform them about my disease with words, but I would rather they take a moment to take this piece of art in, and that will tell them everything they need to know about my disease. And I think it really was a striking way to present that, and a lot of them were kind of caught off guard. And I think, like I said before, my art could be a more direct way of communication, and in strangely a more human way of communication as well with the staffers and Congress people.
I gotta say, so Wes and I were both awardees in the same year, and I remember spotting Wes way across the lobby of one of the Senate buildings wearing that shirt, and that was the first time I had spotted you during that time, and I got so excited seeing that shirt. It was seriously the coolest thing. You should sell those. But as to the question, I feel like for me, art is almost like the bridging point from even being able to get to that place of feeling confident enough in myself to share my story with others, and especially with legislators themselves. And I think also trying to condense your story into those, your 90-second elevator pitch, or even shorter than that, 30 seconds. I think having your art there as a tangible way to tell your story is extremely helpful. My piece from last year, which was called The Twist of Life, and it's this piece that can be inverted upside down, showed one way or the next. I kind of use that as a jumping off point to talk about how my life got turned very much upside down with my illness, and using that kind of metaphor to structure the way I tied my story to a specific piece of legislation, which is really cool.
I'm curious, I know all of us are on social media, probably most of us, right? And so I'm curious for you all, I know you're engaging with your art on social media, and I wonder how is sharing your work publicly beyond just the rare artists community shape the way you see your role as an advocate? Has anything changed there for you?
Yeah, every time I share a post on social media, more specifically on Instagram, it just really not only boosts my confidence and just owning up to my disability, but also hopefully inspiring other people to try something new, to go for it. All the time, a lot of times I'll get messages from people asking for some encouragement, and they'll thank me for sharing my story. And I think it's, like I said earlier, it's a ripple effect. So the more we talk about it, I think the easier it gets, and just really owning up to your condition.
Yeah. Marcel, anything you want to add to that social media question?
This is when I start to feel old, that I'm not a real master of social media or anything, as my kids would say. I did use more social media back in 2020 when I was an awardee, and had response from that. I haven't done much lately in the area of social media, and I want to do more, but I got to get my kids to help me, I think.
I'll say that I have beef with social media. And I think the reason I always keep coming back to it, though, is the community, the rare disease community that just really fills my cup at the end of the day after a long day of maybe not being around people who fully understand the experience of it, and being able to find that support. And also, I feel like I love getting inspiration from other artists in the rare disease community, and I feel like that's my argument for making social media more useful rather than doom scrolling.
Oh, yeah, the doom scrolling. We won't talk about that, though. We just want to doom scroll art, right? That's our new. Yes, we will make that happen. A lot of you've referenced didn't know if I was an artist, and I'm going to say I was at an art event at our gallery, and everyone has that 6th grade art teacher that told you couldn't do art. How many of you had that 6th grade art teacher that told you, right, that teacher was wrong? I'm just telling you now that teacher was wrong. And so I know you've heard people say that hesitate to submit or apply for the Rare Artist Program because they don't think they're a real artist or professionally trained. What would you want them to know? What would you tell them? You just saw all these people raise their hand to say that they're not artists, but what would you tell them that they are?
Yeah, I think everybody's an artist. Everybody can be an artist. Whether you want to embrace that or not, that's your choice. But I think art is grown-up play, and I think we can all play. I think we can all communicate. I think it's a privilege that we hold back ourselves from, and it's only your own limitation. So I would encourage you to embrace that.
I'll say something that my ceramics teacher actually told me. And by the way, she was my 6th grade art teacher, and she was the one who turned me on to art.
Okay.
So
we got one 6th grade art teacher that got it right. Yay for that teacher. Yes, yes.
Yeah, shout out to Miss Campbell. But she was telling me how oftentimes your art will unintentionally reflect the things that are happening in your life, whether you intend for them to be about them or not, if that makes any sense. And I think what's really cool is, like when I put my hands on the clay, I'm not sure where I'm going. There's a lot of just, I don't know what it's going to turn out like. And then the story unfolds as you make the piece. I don't know. I didn't expect that little twist pyramid that I was making for the twist of life would then be hollowed out and inverted and turned upside down. And then the story was like, oh my goodness, this is exactly what's been happening in my life. So I think even just using art as, see where it takes you. The story will unfold. Don't feel pressure to attach like a very specific story to it, because that's the beauty and the unexpectedness of art.
I'd also like to add on that I know many of us sometimes we compare ourselves, and I think that's a problem, and it can scare you from wanting to move forward. And if you just tell yourself, just find that inspiration rather than comparing, whether that's go out for a walk or read a book or just take a break from social media or just put yourself in a positive atmosphere. I think that'll just figure out what works for you, where you're not finding yourself comparing with other people, because I know a lot of people do that today, especially if you're on social media.
Very wise advice.
Yeah.
Well, we have time for a few questions from the audience. Does anyone have any questions for our panel? Yes? Yeah, there's a mic coming. Hang on one second.
Hi, my name is Lauren Meeks Harris from Roseville, California. And my question is, have you guys ever received, say, backlash? Because as much as you may share, one of the things that has come back to kind of bite me personally is when I did share on social media, particularly about my particular trial about my illnesses. Unfortunately, some people in my workplace thought it was a nice thing to personally expose. And I was wondering, especially with the gentleman who worked at DreamWorks, did that become a particular issue?
It was never an issue for me. I didn't, although I didn't, most of my art for advocacy work and the art that I've created about my disease was post my career. So, but there are people at work who knew, my particular disease as well, and they're all very sensitive. I think, yeah, privacy is obviously a big issue, and I personally would rather be vulnerable and run a little bit of risk, but everybody has to kind of make that their own decision, how vulnerable they want to be and how widely they want to put something out.
Yeah, I think it just really depends, like, how far do you want to share? Like, how much do you want to share? So for me, with my wood burning art, I will, because I'm hard of hearing and legally blind, I actually do know some sign language and I do know some Braille. So I will incorporate some Braille and American Sign Language with hands, with my wood burning, and that leads to conversation. One of my favorite wood burning pieces is this blind chick driving a Jeep Wrangler with her white cane outside the door. And she can dream, she can hope, right? But like I said, you can have, if you feel comfortable, find humor, and just go with it. If you feel comfortable sharing your story, it's up to you.
Yes. Oh. There's a man in the back, too. So I think she's going over there, then we'll come over to you.
Hi, I'm Eric Hartman from New Orleans, and I have a rare eye disease, and I have lost my vision from the outside in. So when I look at the panel, I only see one or two of you, depending on how close you are. But I wanted to say that over my lifetime, I was told not to do art because I was going to be blind by 40. It turned out I was legally blind at 25. But I took up paper mache sculpture, and then I learned how to paint, and I was an impressionist painter. And nothing made me feel better than to be out in a French vineyard painting, and all these tourists would come by. Oh, look at the artist, look at the artist. And then they'd go to the cafe, and then they'd see me walk by with my cane and my bachade on my back. And it's like, mon Dieu, what is that? But now that my vision has gotten to the point where I'm now at the point of losing color perception, I've gone back to clay, and I love the idea of clay. And now all of my artwork I'm doing on panels that the visually impaired can also touch and feel and experience the places that I've been able to paint.
That's so cool. I love that.
Thank you for sharing that.
I think the hook is being put out for us, unfortunately, because y'all have a very tight schedule. So
I actually have a surprise for everyone. I have to give a shout out to Sophie, one of our 2025 awardees. I got a text at 2:37 saying just landed. It is 3:40. Sophie was planning to sing her song, and I'm so happy she literally just walked in to be able to sing. So she's prepping her guitar right now, so hang on for just a second. But I will share a little bit about her before she comes on the screen, and you'll be able to see her lyrics in front of you. So as I mentioned, Sophie is a 2025 Rare Artist Awardee from Connecticut. Got through the snow to be here. Sophie is a twin. Her twin has MED13L. She is her sibling, and her twin is actually her inspiration for all of her music and all of the music and work that she creates. So Sophie is actually here today to sing her song, Another You. The message and meaning of this song is really about how rare disease can make us feel different. And everybody feels different sometimes, but when we realize that we are all different, we don't feel so alone because there's somebody else like you out there. There's another you out there, the name of Sophie's song. In Sophie's song, there are oohs to honor those who are nonverbal, so everyone can have a voice. There is also a moment of silence towards the end of this song, and this honors the sacrifices that people don't always see, which we heard a lot about today. The words, as you see, will be on the screen. Feel free to sing along with me, because when we all come together, we are not so rare. Please join me in welcoming straight off the plane, Sophie Seaver.
Hi, everybody. I'm Sophie. As Stephanie covered, this song is called Another You.
It means a lot to me, and it also means a lot to be here. I just got off the plane. I just got here, so here goes nothing. You were born watching the stars, and they all wondered how you'd reach that far. And you'd ask, like everyone knows, why giants reach stars on tippy toes. And I know it's not that fair, but my friend, there's another you somewhere. It can seem like you're not from here. I just need you to know difference is a feeling we all share, my friend. There's another you somewhere. Oh, together we'll go farther. And together we are not so rare. In the end, we are all looking up at the same stars. Thank you so much.
Standing up.
Nell and Sophie are rare artist buddies. This is their first time meeting in person. Thank you so much, Sophie. This is going to be a story that you'll have to tell for a while. And thank you, Lisa, and our amazing artists for the incredible conversation and conversations of your art and your stories really matter. Everybody is an artist. I encourage everyone to visit the Atrium Rare Artist Gallery today and tomorrow to see the 2025 Rare Artist Awardees. The artists will also be there during the first break at 10:15 a.m. to 10:35 a.m. If one of their pieces resonates with you, I ask you to consider taking one of their postcards that has their artwork and their artist statement on it, and consider taking it to Capitol Hill to help share your story. And maybe these pieces will inspire you to ask, what would your story look like through art? Rare Artist opens again on June 8th and includes visual art, music, poetry, and new this year, short form video. We hope you'll consider your work. Thank you. Okay, amazing. Between now and 3:50 p.m., we will start transitioning to our next breakout sessions. These are in this atrium hall. Right here is track 1, the intersection of identity and advocacy, a pride in rare conversation. Track 2, Advocacy for Young Adults will be across the atrium in Ballroom A. And Track 3, New Advocates, Welcome to Rare Disease Week, will also be across the atrium in Ballroom B. We will see you in a few minutes.
Hello? We're going to get started in this room in about 1 minute. Everyone is welcome to stay, but we will get started in 1 minute. All right, we're about to get started. If everyone could please take their seats. Wonderful, thank you for moving closer. Love to see it. All right, if you're not attending this session and are still talking, if you could please exit the room to continue your discussions. Otherwise, we will get started with our Pride and Rare conversation. If you haven't met me before, my name is Abby Hauser. I'm our Associate Director of Community Engagement here at EveryLife, and one of the programs that I run is the Pride and Rare program. I'm really excited to have you all here today to discuss the intersection of rare disease and LGBTQIA+ identities and how we use that intersection to create power. As someone with a rare disease and who is part of this queer community, there are so many times that these intersections appear in my life. Whether it's the challenge of accessing gender-affirming care without complications due to my rare disease, avoiding certain medical care for lack of certainty in a provider's background or the safety of an appointment, or in the ways that my relationship is questioned when visiting a partner in the hospital solely because of their gender, plus many more examples, these identities cannot be separated. And it's why we aim at EveryLife to find an avenue for these intersections to have a voice and a space. We want to make sure patients and those who run patient advocacy groups have ways to support their queer patients that also have rare diseases. And while this is a challenge, as you might imagine, there's also a unique joy in this community that we have, such as when we get to walk into a new doctor's office and they ask you your pronouns, or you see a rainbow flag, or the moment a provider reads your chart and gets the pronouns right without you asking. Those are unique moments of joy that they can't take away from us and that we get to experience because of our place at this intersection. So while we might focus on the ways that we're creating change, there are also really types of joy that we can focus as we center ourselves around this work. And this is where our power lies. And one of these ways is to start by joining together to amplify our voices through community and speaking our intersection of identities into more rooms. These are beliefs I hold true, and even through these recent times, I know our voices are still stronger together. Today's format is an interactive conversation with an incredible advocate I'm super excited for you to meet. We're going to discuss how the intersection of your identities can show up in your policy advocacy work. And if you are here someone who represents a nonprofit, it might give some examples of how you can better support your patient population as well. We're going to discuss how these show up in your advocacy, including an example from one of our policy asks that happen later this week on Capitol Hill. And with that, I'll hand it over to Hannah to introduce themselves.
Thank you, Abby. I'm very excited to be here today. My name is Hannah. I identify as queer and non-binary, and I use they, them pronouns. I have been a member of the rare disease community for a very long time. I started as a family member and caregiver when my dad was diagnosed with mucous membrane pemphigoid in 2008, and started coming to Rare Disease Week when I was 14 years old to advocate on his behalf. And by coming to Rare Disease Week and connecting with so many amazing advocates, I was able to find out that I also had a rare disease, but not the same one. So I have hypermobile Ehlers-Danlos syndrome, and there's actually a very big overlap between the EDS community and the queer community. There's a lot of queer EDSers out there. So I'm here to represent them. And I currently go to George Washington University here in DC. I'm getting my master's in public policy and philosophy with a focus on disability and rare disease so that I can continue my advocacy in my career. And I don't know, I think that about covers it for a basic introduction for me.
Thank you so much, Hannah. That was great. I met Hannah at I don't even know if it was your first year or when.
It's like a really long time ago.
Really long time ago. And it's been really exciting to continue this work and help prepare this session. But one of our policy asks that you'll be learning a lot more about tomorrow is called the Credit for Caring Act. And it's an act sort of around a tax credit for caregivers. And sort of why this bill is needed and why we're talking about it in this context, I'll go through a little bit so that we can kind of discuss how you might bring this intersection into one of your asks or how you bring that into policy. But the need for this act is that the truth is 1 in 4 adults are family caregivers of some capacity. And 78% of these people spend over $7,000 a year on care that is not covered by insurance. And for a lot of families, that's about 25% of their income that they are spending on caregiving expenses. And the solution that this bill talks about, just super high level, you'll get into this tomorrow, but the solution is a tax credit for family caregivers that can help give some money back to help cover those expenses that are being paid for. And why that matters to this intersection is because there's a lot of data out there on the state of LGBTQ plus caregivers, and most often it is pretty bleak statistics on what that looks like. So lower income family caregivers and queer family caregivers often use help, whether paid or unpaid, less often than their non-queer counterparts. Only about 25% of queer caregivers have paid help, and only 43% have unpaid help, which are a lot different to the other population. Queer caregivers and lower income caregivers are also more likely to report their health as poor, which means because of their caregiving and just the duties and the stress and everything added to it, they're reporting worse outcomes on their own health compared to their non-queer counterparts. And then compared to non-queer caregivers, queer caregivers also more often experience negative financial impacts, which is the difficulties in saving, difficulty in affording basic expenses like food, bills, housing, things like that. So these are all data that we have on general caregiving in the United States. This is from the 2025 Caregiving in the U.S. report is where those stats came from. And just to see those, while it's looking at caregiving as a whole, we do know rare disease caregiving fits into these stats as they exist. And within that, you can kind of see, maybe you're kind of seeing the picture that I'm painting of the intersection, because this bill is a way to help relieve some of those financial burdens for caregivers. And you can tell that that burden is impacting the LGBTQIA plus community at higher rates compared to their counterparts. And that's sort of an example of how we can find these intersections and speak them into rooms. While this bill is focused on just that tax credit, there are certain ways that we can go about speaking your intersection and your identities into these rooms that didn't. The bill's not written for it, the bill's not asking for that intersection, but when you show up, you can't separate your two identities. So they're coming together regardless. And in certain situations, there are great ways that we can elevate these and advocate for that intersection in a lot of different ways. So Hannah, I wanted to ask you, whether it's with this bill or sort of another connection, how would you make this intersection, I guess, more tangible or brought up, in, whether it's in a legislative meeting or whether you're just advocating with friends and family?
Yeah, I think, when you were reading out those stats, I was kind of noticing a little bit of thematic overlap with some of them. So caregivers who are LGBT being more likely to report poor health outcomes. If you're going into an advocacy meeting with somebody who is, a champion for healthcare equity, that's a great stat to bring in there. If you're meeting with somebody who, is a champion for LGBT rights, obviously I think that's always going to be a great opportunity to bring that in, but you might not always know if that's the case when you're meeting with a staffer or a congressional office. We can look at their rare disease scorecard, but we don't really have an extensive scorecard on every issue that an office is going to take a stance on. But I think, seeing thematically, like, what do I know that this office cares about? Do they care about healthcare? Do they care about equity? Do they care about, the economy? Finding those thematic overlaps, I think, can be a really good place to bring in these stats and to bring in the queer identity for yourself. But I think as well, just talking about this more broadly, like within the queer community, in my experience, a lot of queer spaces are not the most, you don't always see a lot of disabled people, you don't always see a lot of accessible spaces. And so I think just like bringing that into your queer community, like all the time, like just having a conversation with your friends and say, hey, did you guys know about this? Because this will affect, 1 in 4 of us at some point in our lives. Would just be a really good way to build coalition between the queer community and the rare disease community.
I think those are really great points, especially when you mentioned figuring out what the office, might be interested in, or where you can find the right avenue to make sure that it's the right place to bring this intersection, but also bringing it wider. I think as a rare disease community, we're strong in our numbers, we're strong in how we show up, but we can invite more people to the table at all times. Our table is not limited here in rare disease, so I think we can bring in friends, family that have no direct connection to advocate for rare disease in general, but you can also bring them in at this intersection as well, with these general stats, because this, especially the Credit for Caring Act, while we're focusing on it through the lens of rare disease, will impact almost anyone that might potentially care for a aging parent, or care for a sibling or a partner or a child down the line. There's just so many overlaps that we can bring more people to the table for this bill on. While we want it for our rare disease community, you can really find this intersection and bring more people to the table to advocate, and that's how we continue building our numbers and bringing that intersection in. So I think that was a really great point.
Thank you.
And the other point of that, where you said, to find what an office is looking for, how do you decide when to share and what to share at this intersection in your advocacy?
That's a really great question. So I think for any meeting that you are going to, this week or in the future with your advocacy, I am always going to start by asking myself, does this feel like a safe space to, verbally bring in that intersection of my identities? Do I feel like I'm comfortable in this office talking to the staffer about this? And if the answer is yes, that's great. And I think, planning ahead with your team, we all have our asks and what we're going to talk about, just making sure that everybody knows, this is our plan for today, and making that direct tie between your identity and the policy ask. I think that's a great place to do it. If you're in an office and you're not totally sure if you feel comfortable bringing that up, I think that your safety and your comfort should always be your number one priority. I don't think that you should put yourself into an uncomfortable situation with a staffer, especially when, it's about your identity. It's something so personal. But I think there are so many other avenues that we can take to bring these intersections together. Like they were just talking about at the previous panel, art is such a great way to bring your queer identity and your rare disease identity together and share that with people in a way that is, bridges that gap of communication. Talking about it on social media. I have met so many incredible activists on social media talking about their queer identity and disability or rare disease, bringing it into queer spaces, bringing it into disability spaces, bringing it into those, communities where you already feel some sort of safety net, that this is an okay place to be openly queer. But I think regardless, I'm going to be going into these meetings with my they, them pin on all day, and I look the way that I look. So I'm going to be showing up queer in the meetings no matter what. I think it's just a matter of how far do I want to take that in the professional advocacy sphere. How much do I want to put myself and my comfort on the line while talking about a policy that directly impacts me and people like me?
Yeah, I think what you said about how you show up matters too. And sometimes, if that is just how you just show up as your authentic self, you don't have to say anything beyond that. That is still taking a step. That's still acting at that intersection. And I think that's very important because your safety is the first priority, and no one gets to decide what that level is except for you. So regardless of if it looks different person to person, that is your decision, and what you decide is correct. I think that's what I just always emphasize to any advocate that asks me in that space. Whatever feels right is right to you, but definitely, take the time to think it through. I think sometimes the in-person conversations are the easier to have, to be like, hey, this, policy really matters to me. My community is doubly impacted by the caregiving crisis, whether it's my rare disease community and my LGBTQIA community. There's a lot of intersections that I would love to see fixed, especially by the time that, we get older. Or I think we also forget that you can have a rare disease and become a caregiver. We're not necessarily always the ones receiving care. We are still able to give care in some capacity, depending on your abilities, and even not physical care. There's other forms of care that we are also giving to people. So I think bills like this, especially the Credit for Caring Act that you'll learn about, have a lot of really good potential for speaking this intersection into some rooms. There's not going to be a perfect bill out there that is just for both identities come together to solve one issue at this point in time. So I think our job as advocates with at this intersection, or if you're a nonprofit, especially if you're a patient advocacy group and you're looking to figure out how to support your queer community, I'd love to talk to you. That's a passion of mine, is figuring out how we can get all of our PAGs to equally support their communities really strongly. And I think there's a lot of spaces and communication avenues that we can all take to bring this intersection into real life.
Yeah, I totally agree. And I just had another thought too, is if you're not sure, or you're feeling a little nervous, or you chicken out about bringing in the intersection during your meeting, put it in your follow-up email. Give them some of these like more specific stats on LGBT caregivers and the Credit for Caring Act, because, or put it on a one-pager and leave it for them. Even if you're not comfortable talking about it during the meeting, there's still a way that you can deliver that information to them.
That's a really great point. I love that. Those are our main 2 points, and we wanted to give an opportunity to open it up to the audience. If anyone has any questions at this intersection, how you advocate for this intersection, or even anything semi-related. Yes, Colin. Wait, we have someone will come with a mic. It's very official.
Okay, that makes me more nervous. Question about the bill.
Yeah.
So when you talk about caregiving, does it have to be a legal relationship? So say you have a partner, you're not married, but you're their care partner. Would the bill cover those relationships as well?
That's actually a great question, and one that I did reach out to our advocacy team about when we first started this intersection, and I got a response, and I would have to pull it up because they do broaden the definition, but they broaden it using IRS terms, so it seems like there's a way that it covers it, but it's like in writing, it's not as clear. But I can get you that email that I have from the AARP who wrote this one-pager for us. I have an answer directly for them that I can give you. Yeah, thank you so much. That's a great point. That's one that I also flagged when I was looking, because even if we get this bill passed and it doesn't cover that, that's kind of like a next step type situation as well, or if, that's a second step of advocacy. Because there are some really good stats about how often the queer community is caregivers for non-relations as well, whether it's their chosen family or things like that. So there's a lot of good avenues that we can really take caregiving, I think, in this space at the intersection. Yes.
Hi. Thank you for being here and having this discussion. You took me to a place I did not expect. My wife and I she's in another session right now, and we decided to divide and conquer. We're grandparents to Rowan, who's a 2.5-year-old that has a rare seizure disorder. So we're perfectly comfortable, and honestly, if we're not comfortable, we still introduce ourselves as, this is my wife, and we're the grandmothers too, because we know even if we're not comfortable and we do that, we might be making someone else feel comfortable and have the power to do that. But you brought me to a place in 2008, 2009, when I was caring for my first wife who died of cancer. And although in California our marriage was legal in the state, it wasn't even recognized federally to get that FMLA for me as her caregiver. So when you talk about, as you guys age, what it's going to look like, I now see how it's changed and what we've grown into. So I just want to acknowledge that over the years, at least we have that acknowledgement now.
Yes, thank you for sharing that.
I just wanted to comment on that. Thank you.
Yes, thank you so much for sharing. I really appreciate you doing that. Thank you. Yeah, let's clap for that. I love that. Thank you. Colin's doing an actual run.
On the Credit for Caring Act, do you know if they are pushing to have that be able to take care of someone or get the credit for more than 1 year?
I do not know that off the top of my head. We can circle back tomorrow, too, when we learn about it. There's going to be a whole session on specifically the Credit for Caring Act. The duration of the credit is not something I'm familiar with. Thank you for asking. That's a great point, though.
I just have a more general question.
Yes.
So I'm a mom to kids with a rare disease, and the older one is currently figuring out his queer identity. And I have so much anxiety about his rare disease, and now a little bit about this just because of the world we live in. So, not because I'm worried about him, it's the rest of the people. So, any advice for moms supporting kiddos with rare diseases and who are queer?
Yeah, I mean, I am not a parent, but I have 2 of them. And I know that, concern for your children's well-being is like one of the top priorities in your mind at any given time. And already navigating a rare disease can be so stressful and, anxiety inducing and traumatic and isolating, and finding this community, I know for me, and I'm sure for everyone else here, has helped to alleviate some of that anxiety. We're still dealing with all of the same issues, but we know that we're all dealing with these issues together, and we are actually, gathering and working to try and alleviate some of that. And I would say for the queer community as well, like finding community with your children, and going to like a pride event as a family can feel so hopeful, and you just feel like this joy in community with everyone around you. And so I think finding pockets of joy and community within, both of these identities and within the intersection is really important to, support not only yourself, but to also support your child. And then you become part of this interconnected web, of people who understand a little bit about what you're going through. And I know it's a really scary time out there right now, and I think that the most important thing is just to be there for each other, because that's how we're going to get through it.
Yeah, Hannah said it way better than I ever could. Hannah, when we were preparing for this panel, actually had mentioned that Rare Disease Week and events like this was kind of one of the first times that you realized that you were not alone in your rare disease experience, and felt like you could just freely talk about things that you kind of had to tiptoe around before because other people in your life didn't get it. And I think that's kind of the best advice that I would give too, is to help your son or your child find spaces that they can feel that community in, and test it out, whether it's through an actual meeting, an informal thing like this, just meeting other leaders or mentors or things like that. I was diagnosed with my rare disease when I was 7 years old, and I did not start saying the name of my disease out loud until I was 21. And I think I would have preferred to have community sooner. So I think I feel the same way about my queer identity in that intersection as well. So I think finding it sooner and finding that community and just seeing what that looks like, seeing where that comfort level feels like, is something that I wish I had growing up. So I think that's advice that I consistently give to parents, is things that I wish I had as a kid. So that's my biggest piece, is just kind of keep trying, whether it's inviting him to a Pride and Rare meeting, or you could attend one, just to be in those spaces as well, to see where you can best support that intersection as well. Thank you for asking. Is that good?
I'm just going to jump in real quick. Hi, for those who don't know me, my name's Dylan Simon. I'm the Senior Director of Policy here at the Foundation. I just want to answer the policy question.
Oh, yes, do it, please.
From before. For the Credit for Caregiving Act, the way it would work, it would be a new tax credit, and there is no sunset provision within the legislation, so therefore it would be there for multiple years in a row. There would be a $7,500 cap on the tax credit, so you would have to track your receipts in any given tax year to then submit that for the reimbursement. But it would be over, it is not a one-time tax credit. The idea is this would be permanently implemented and would be used continuously moving forward.
Perfect. Thank you so much, Dylan. Let's give Dylan a round of applause. Thank you very much, everyone. If you are interested in learning about our Pride and Rare program, feel free to stop me at any time. I can give you my card and get you in touch with what we've been doing and what we're going to continue doing throughout the rest of this year. And I'm always happy to jump on a Zoom call and have a conversation. So thank you very much for your time. I appreciate you listening, and enjoy your Rare Disease Week. We're here.
Thank you.
Thank you.
Right?
Yeah.
Hello. All right. Hi, everybody. Thank you for being here. Whether you know it or not, you selected the graduate level breakout session. Hope you're ready. All right. Thank you so much for being here. I am Annie Kennedy, and I serve as our Chief Mission Officer for the EveryLife Foundation. And we are thrilled that everybody is here today. Thank you so much for being here this week, first of all, and for braving whatever weather conditions you braved to make it to Washington. Thank you so much. So this session is a session around how to connect data and evidence in rare disease with your personal journey. And this session we're especially excited about because about 6 years ago, it became very important to us to start to really move away from those back-of-the-envelope estimates around how many people in the U.S. are living with rare disease, how long does it take to get diagnosed with a rare disease, what is the cost of the diagnostic odyssey in rare disease, to have some real hard data around that. And many of the people in this room have contributed to our efforts to be able to collect that real evidence. And so we now have published collectively as a community, I think it's now 14 studies that we've collectively done here together that are now cited. We see them studied worldwide. We see members of Congress cite the data. We see our citations pop up everywhere, which is wonderful. And I just want to give you a couple of examples of how some of those came to be. And what this session is making sure that that data works for you. Because for us, it's not at all about just getting things published in academic journals. The reason why that matters is because then it becomes data that payers will use, and members of Congress will use, and regulators will use. So it matters because it legitimizes our community and it raises the flag of rare disease as a public health priority. But at the end of the day, if it doesn't really reflect the lived experience of everybody in this room, it's not working. So the way a lot of these studies have started is, I'll give a couple examples, and some of the people might be in this room. So our first study that we did was the National Economic Burden of Rare Disease Study. And show of hands, anybody who helped inform the design of that study, participate in the survey, was a part of the data collection. Okay, I see some hands go up. Awesome. Thank you so much. So after we disseminated that study and we were pushing that data out, we were having, during our team meetings, we often have members of the community come and meet with our team and share more about their experiences and what they're advocating for with our team. And is Paloma in the room right now?
She's in the hallway.
Okay. Paloma's in the hall, but I'm going to tell a story about her. Paloma came and presented to our team about her journey and about her advocacy that she was working on in newborn screening. And at the end of the time that she was spending with us, I asked her, Paloma, what you're doing is incredible. What additional resources or data would you need to embolden your advocacy? And she said, I need real data around what the cost has been of our diagnostic odyssey. I need real data around what the difference was between the diagnosis of each of my boys. Because when I'm advocating for Pompe to be added to newborn screening panels, I'm often asked, how much was that avoidable cost in the diagnostic odyssey? And that was one of the things that we were sort of teasing around, should we do a cost of diagnostic odyssey study? So here's what happens when you're working with the EveryLife Foundation. We say, great, come join the steering committee. We need you on our team. So she actually joined the team of methodologists who were working with us, and as many of you know, we did a diagnostic odyssey study. So that's one of the studies that we also did to look at what are the avoidable costs in the diagnostic odyssey across 7 conditions, and Pompe was one of them. We also have a PFDD guide. The PFDD guide looks at the Guide to Patient Involvement in Rare Disease Therapy Development. That started because at one of our coalition meetings, our community congress meetings, after all these patient experience guidances were being pushed out by FDA, which were wonderful, informing how patient communities and patient experience data should be included in regulatory decision-making and clinical trial design, somebody at one of our meetings said, well, this is really great, but how does this apply to rare disease? Because these were just broad guidances across clinical development. And we asked FDA, these are great, but are you planning to do a guidance of guidances as applicable to rare disease? And FDA said, that's a great idea, but we're not planning to do it. So we did it. As a community, we did it. And that's what the PFDD guide is. So those are just some examples of how those started. And Jamie will talk about a few of the others. However, those only work if everybody in the community knows how to then pull them back into your individual advocacy, either as your respective patient advocacy community or your individual journeys when you're advocating to knock down the barriers in your journey. So that's what we're going to talk a little bit about today and start to give you the tools to make sure you know how to do that. So Jamie, I'm going to hand it to you, and then Bailey will take us through some of the tools that we're building to make that easier to do.
I'm actually going to call a little bit of an audible because we think we're going to give some of those more examples when we get to the final slide, which covers a whole map of the different resources.
Okay.
So Bailey, take it away. Okay.
All right. Hi, everyone. My name is Bailey McGowan, and I am our Director of Policy Research here at the EveryLife Foundation. And we're going to talk a little bit about incorporating data into your storytelling. So there we go. Look at that. All right. So you might be asking yourself, why is data important? You might also not be asking yourself that because you're voluntarily in this room chatting about it. But data really helps connect your story to the ask. It can help highlight the why or the what for your legislator, and it really helps show the level of the impact of your problem or your ask. And we'll dive a little bit deeper into those in just a second. But so we can all sort of get on the same page with what do we mean about data? Data is factual information used as the basis of reasoning, discussion, or calculation. Data can really be broken down into two different categories. And so we look at qualitative data or categorical data, which is non-numerical information. So that's what you live, what you experience, something that you see, something that you feel, can be expressed in an interview. There's also quantitative data, which is a little bit more of sort of this new category, and that's the numerical data, information that can be expressed in numbers, something like a statistic, a population size, epidemiology, or financial information. But if you think about it, you guys have been using data this whole time. Your story itself is data. It's your lived experience, that's the factual information that you've seen that your legislator or decision maker doesn't know about. But if you add some of this quantitative data to it, you can really help round out that story and really help be convincing and make something really compelling and help bring it home. So again, the impact of your story is it creates that empathy. You're taking a policy issue out of a one-pager, off the page, and you're helping give a lasting impression to why this issue matters. You know, staffers, legislator, decision maker can read something on a page all day long, but until they've really heard the impact of it, I don't think it quite hits home what the issue that you're describing is. Now, data, numerical data, can really help show the impact of an issue. 95% of rare diseases don't have an FDA-approved therapy. Really easy piece of information to slip in that shows sort of the breadth of a problem. Looking at size, 30 million people have a rare disease. You can talk about the epidemiology of your own condition. And then for legitimacy of a problem, Annie said it best with the rare disease information in our rare disease study. 379 rare diseases was about $1 trillion in 2019. You can also help show the legitimacy of a solution. Before the Orphan Drug Act, there were only 38 therapies approved for rare diseases, and afterwards there were almost 900. It's all great pieces of information that you can help sort of slip into something. But once you have the information, you sort of have to figure out how to work it into your story, and that's the next step. So In our own story and advocacy training, we really like to look at some problem, the solution, and your ask. Now, these are starting points. There's plenty of other questions you could ask or data that you could fill into these categories. But if you think about your problem, how many people are impacted by this issue? What's the cost of the problem? And is there an impact on the state or district? And I know that one's a lot harder to get at sometimes. That data is not always available. But if you can show it, it really helps drive home to that legislator what it means back home for them. Looking at your solution, is there cost savings? How many therapies or medical products were developed? So maybe thinking about the PRV. I'm just going to throw out a celebration for the PRV being passed really quick. And thanks to our entire community, we helped push that through. But we were able to show that since its inception in 2012 and since they were issued in 2014, we actually have new numbers. 65 PRVs have been issued. It's 65 therapies we didn't have before. You can look at lives saved, disability avoided, or impacts. And again, if you know the impact on a state or district, if it's available, great information to throw in. And looking at your ask, if there's effect of previous policy, so sort of threw it out with the PRV, but I'm just really excited, so I'm going to keep talking about it. There's the impact of the Orphan Drug Act and so many other policies that could be mentioned, especially if something has to be reauthorized. Number of co-sponsors is really great to show, and that one sort of teeters between quantitative and qualitative data, but you can show bipartisanship through that, and then any agency support or engagement, which again, kind of teeters in that in-between, but if you have it, it's always great to show. Now, this seems like a lot of information and a lot of data that you're trying to throw into one elevator pitch of a story for the quick meeting that you have. I think the really important thing to remember here is you don't have to answer every one of these questions every time that you're telling your story. You can pick one or two pieces of information that really just help drive what you're asking for home. And that's why I really love the way that we break it down, because if you have a clear ask, it's easy to find where exactly you want to put that one or two pieces of information. But your story is still the heart of all of this. Your story is what's driving it home. It's your unique perspective, and that's what you're bringing to this table. You'll have a one-sheet, a one-pager, a leave behind that you can bring. That'll have plenty of information. But if you can get your story to sort of be the leading star of the show and use that data as a supporting cast, that's really where that really shifts and helps move your story along. So we're coming up on an interactive question. So just to prepare everyone before we read, please engage, because it makes it really awkward if we have to call out people. But we have really friendly mic runners, so I think we'll get some people. But we're going to go through this example. Carla's a young rare disease advocate with a rare motor neuron condition that impacts fine motor control, and this condition impacts roughly 1 in 10,000 people. This condition has no FDA-approved therapy. She has meetings scheduled with her members of Congress where she plans to advocate for robust funding for the NIH to support research grants for rare disease community. To prepare for her meeting, Carla has researched NIH funding and rare disease innovation. Below is what she has found. The Rare Disease Clinical Research Network, or RDCRN, so I don't have to say that again, has supported research at over 300 clinical sites, leading over 3,000 publications and 11 new treatments for the rare disease community. The Rare Disease Clinical Research Network at the NIH has provided $26 million in grants in 2025. ARPA-H funding has been awarded to over 50 projects to support innovative breakthroughs in health research, and the NIH has set aside $1.4 billion from its research and development funding to support early-stage research in partnership with the Small Business Innovation Research and Small Business Technology Transfer programs run by the Small Business Administration. I never thought I'd say small business so many times in one sentence. But looking at this, let's think about sort of how she could best incorporate some of this data into her meeting. Where could she incorporate it? Or are there any points of this that really stand out that you think could be mentioned to support her ask? I've got one right here. Thank you for not making me have to call on people.
Lindsay.
Hi, I'm Melissa, Charleston, South Carolina. I'm a genetic counseling student, and I have a rare disease as well, HEDS, if you're not familiar. I think the first one would be great to incorporate, particularly that the RDCRN has supported research of over 300 clinical sites, like you said. That's bipartisan, and I think the first choice would be great to incorporate.
Awesome. Thank you. Lindsay behind. I'm trying to look this way too. There's a speaker in the way.
I'm Caroline. I'm from Delaware. I think the first 2 points are easy to combine. You can talk about this is the amount and this was the outcome. And I would also, if she's been a recipient of one of those treatments, talk about how that research directly benefited her.
Yeah, it's amazing. And that's a really great way to sort of connect existing data into your own story. It doesn't have to be separate from your lived experience. If we've got a third one. All right, we can leave it at 2.
So, I mean, for some of us, this may feel like, and a train left Philadelphia at 3 p.m. What time would it? I feel you, because there's a lot on here. But another thing to do is, so when you're looking at data, is to think about some of this. So the ARPA-H line, for example, is ARPA-H funding has been awarded to over 50 projects to support innovative breakthroughs in health research. If you were getting this information ahead of time, you could explore whether or not any of that funding was specific to rare disease and sort of dig a little deeper and better understand where there might be opportunities to advocate for projects or funding specific to rare disease, or opportunities to direct some of that funding into rare disease projects or into your disease space if you're working with somebody who might be passionate about ARPA-H. So those are some of the types of questions you could ask of data points like this, not necessarily while you're walking through the threshold of a meeting with the legislator, but if you were handed data like this, you could ask sort of inquisitive questions like that of data points like this.
Yeah, and then I would just add, going back to this very first line, when she's talking about her story, what's impacting her, you would also want to think about how you connect the data on what you're advocating for back to her own story and how that would help her. If instead of just talking about what the RDCRN has accomplished, you would then want to kind of circle back and say, if the RDCRN could fund research in my disease and it developed a treatment or an assistive technology or whatever it might be in your case, then I would be able to continue working. And then you could even incorporate, if you had a statistic about the economic costs of early retirement or forced retirement, as we would say, that you could then tie that back to your own impact as well. And so it's sort of coming full circle. You're talking about your problem, you're talking about what has been done successfully in other areas, and then your ask, is if they could fund research in my area, or you added more, if the NIH had more resources, they could probably fund more research in my area, which would then help me buy.
Yeah. So I think we'll move on, but I think our point of putting this slide up was to say, first of all, tomorrow we're not handing you data like this. We're going to already help distill the data down and put it in context. But I think oftentimes we feel like as advocates, we're sipping out of a fire hose. We're being hit with a lot of information all the time and trying to figure out what of it is relevant for me, what am I supposed to do with it? And data like this, we should recommend just approaching in bite-sized pieces. And if you look at this list of 4 data points, the truth of it is, out of the 4, all 4 may not be relevant to you and your lived experience or your community, but one of the 4 likely is. And so the question is, of that, which one probably is the most, and which one should be? And if you were to be meeting with a member, which one could you turn into an opportunity for your community? So that was the point of this. This is a little bit of a commercial we're doing because this year this is a priority for EveryLife, is to do more work like this and to create more tools for the community like this. So, Bailey, keep on going.
Thanks. And excited to continue working on that. This next slide is an example of a sort of data in action and a story. This was submitted from Lisa, a rare disease advocate out of Pennsylvania. I'm a living example of a parent whose daughter's fate was determined not by science, but by a state border. My daughter Tori was diagnosed symptomatically with Krabbe disease only because our state did not screen for it at birth, even though the bordering state did. Today, the Recommended Uniform Screening Panel, RUSP, is the gold standard for identifying conditions for which early intervention is life-saving. Yet the post-RUSP gap remains a crisis. On average, it takes 5 to 7 years to add a federally recommended condition to their panels, creating a geographic lottery in which a child's zip code determines their access to a healthy life. We are essentially telling families that their child's survival depends on which side of a state line they were born. We respectfully ask that state leadership prioritize mandatory RUSP alignment, ensuring that once a condition is federally vetted and approved, it is adopted immediately so that no other parent has to live with the if only of a preventable tragedy. So you can see from this example, you're walking away remembering a mother talking about her experience with her child, with finding out that they had a disease that could have been caught at birth. But that 5 to 7 statistic, just that one piece of data and information in this sort of helps you think and makes you wonder, sort of, why is it 5 to 7 years? How many children are born in that 5 to 7 years? What can we do to shorten that gap? And so it helps get the ball rolling, it gets questions moving. And to sort of take it back to our last slide in this one, you don't have to have all of the answers. What you're there to do is to help convey a policy problem, an issue, and share your story, and again, bring it off the page. If you don't have data, if it's not on your one-pager, that's a great reason to follow up with your office. Continue building that relationship and continue really moving momentum forward on education for your issue. And they might ask those questions if they hear that data point. And again, great reason to follow up, especially if you only have about 15, 30 minutes in an office and you're giving an elevator pitch.
Wait, can you go back?
Can I?
Yeah.
There we go.
Okay. How many people in this room work in newborn screening advocacy or have been advocating for newborn screening conditions? Ooh, look at that. Okay, the good news is we actually have a lot of data to inform some of these conversations. So if you are involved in newborn screening advocacy, we have the data to fill in this conversation. And if you aren't aware of that, we can help you fill in those gaps. So we have a lot of really great data points. It's on our Newborn Screening Action Center. It's available by state. And if you have questions about how to use it, I'm going to call out this gentleman right here. This is Dylan Simon. He can help you. I can help you. Bailey can help you. Jamie can help you. So please come see us. If you're not aware of that data or you're just not sure how to optimize that data in your personal advocacy, come find us over the next couple days and we'll help you with that. All right.
And you teed that up so beautifully, Annie. Thank you. Where to find data? PubMed is a really great resource. It is housed at the NIH. It's the National Library of Medicine's repository for research. So it's a great place to go look. You might not get the full study for everything. It sort of depends on if there's a paywall on the original site, but at minimum, you'll be able to find an abstract and some of that key results. Federal agencies keep a lot of databases. The FDA has great ones. I am on the Orphan Drug Designation Database almost every day. There's also incredible reports coming out of OIG and some of our other agencies.
What is OIG?
The Office of the Inspectors General. Thank you. I knew that one. There's umbrella organizations like the EveryLife Foundation, NORD, Global Genes, et cetera. Your credible research institutions, so universities. I'll also throw out the National Academies of Sciences and Medicine, Sciences, Engineering, and Medicine, or NASEM, puts out incredible reports, and quite a few are specific to rare diseases. There's issue-specific advocacy groups, so sort of depending on what you want to do, you might have a group that already puts out some incredible information and distills it really well. Your own patient advocacy group might have information on your specific condition. And then there's professional societies, so the American Medical Association, Pediatrics Association, Society for Genetic Counselors. Pretty much if there's a profession, there's a society for it, and a lot of the times they'll put out policy issues, policy statements, research, et cetera. And then this is the final slide that I think we've all been waiting for. Thank you, Annie. And Jamie?
Well, before you do that, let me just say one word of caution. This isn't a whole session on how to vet the credibility of evidence, which we may do at a later time. But one word of caution, when you're looking at these sites, when you're looking at statistics and you're trying to find a citation for it, or you're trying to make sure it's a credible source of data, you will find, especially in rare diseases where literature, the peer-reviewed literature, which is what you find at PubMed, can be limited, you will often find sort of what is circular reasoning or circular citations, where you find a statistic that is cited by one of the organizations, and that might point back to another organization. And when you go to that organization and you look it up, it points back to the original one that you were just on, and you can never get to a source, an actual peer-reviewed source. Sometimes that's okay, and in certain circumstances, when you are maybe writing a white paper or you are talking a little bit more broadly, but if you are citing a very specific statistic, like half of children die before their 5th birthday is one we often find. When you go and you look literature by literature, it's really hard to find who was the original source, what data was used to create that talking point, that statistic. So just something to be cautious about when we're talking about how we use data is you want to try to find the most credible sources that you can, and make sure that when you look at where that originally came from, it is a verifiable source of information.
I will also tag on to that when you do a Google search and you get that summary at the top, double check where those are from. Yes. The links are usually on the side, but for that same circular reasoning and making sure it's coming from a credible source. And now the final slide. Oh, no, wrong button. This is a map of our resources, peer-reviewed literature, white papers, PFDD guide, newborn screening roadmap. Shout out to Dylan and the rest of the team for that one. It's our latest. But these go through our publications and sort of what policy areas and policies they really connect well with, and sort of helping optimize and help people figure out exactly where to put it in. I'm excited to continue working on resources that expand on that a little bit more. But all of this to say, just because we have, I think, a minute, if you're ever wondering how to connect these to your own research, to your storytelling, to your advocacy, please don't hesitate to reach out to us. It's quite literally part of what we're here for, and part of what we really enjoy doing is helping people figure out how exactly to use these and incorporate them into their own work. And these are meant to be community tools and resources, most of which were built by the community. Like Annie mentioned, quite a few of people in this room or who will be here over this week were involved in steering committees for that, or were part of focus groups involved somehow. So if you guys have.
So I'll just close by saying we want to hear from you as well. When a lot of these studies were built off the questions that many of you are getting in your Hill meetings, in your state meetings. So if you are getting questions over and over again that you don't have the answers to, we don't have the data to answer, share that with us so that we can really help plan and build out new resources and new data analysis over the coming years. Which does take time, but we may not have the answers right away. But if we don't hear from you about what you're getting in your meetings, then we won't be able to get started in creating those answers. So please share that with us over the course of this week and beyond, via email and in EveryLife events.
With that, I've just got the 0 sign, so Annie.
Oh my gosh, that was such good timing. I just want to, first of all, thank Jamie and Bailey. I also want to acknowledge Bailey. Bailey's whole title is Policy and Research. So she is a treasure trove of information. So please, 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 while everyone on our team is a resource to you, this woman right here would be a really great resource. So stop her in the hallway if you have a question about any of this, and utilize all of us as a resource, please. So thank you very much.
Thank you.
Great job. Oh, wait,
yep.
This is the good part.
Yeah.
Oh, they shut us off before I told you
there we
about
go.
the reception. You guys, now the bar is open. They keep smacking people away from it. This is the reception. So this is when you can hit Bailey up for data questions or just enjoy a cocktail and have a big family reunion. Thank you all for being here. Thank you for an amazing first day. And pace yourselves. This is an exciting week. Thank you, everyone.